Dr. Kalumbi Shangula to present to the Namibian nation his ministerial update. Once again, Honorable Minister, it's an absolute pleasure to have you on board this morning. You may start with your update.
Thank you very much. Fellow Namibians, I'm very pleased to return to the Government Information Center and share information on health matters with the people of Namibia. The information I will share relates to the work of the Ministry of Health and Social Services in providing, improving, and expanding quality, accessible, and reliable healthcare services for all Namibians, ensuring that they live healthy lives. On the 10th of April 2024, I presented an extensive report at this platform on government activities in the health sector. I wish to state again that more than 85% of Namibian population depend on public health and social services provided through hospitals and other health facilities managed by the Ministry of Health and Social Services. This includes 322 clinics, 56 health centers, 34 district hospitals, 4 intermediate hospitals, and 1 national referral hospital. There are more than 1,150 outreach points across the country. In line with the costed plan to mobilize additional resources for the public health sector, the government will also build health posts in different constituencies across the country. The services offered at public health facilities include health promotion, preventive and curative interventions, immunizations, as well as tertiary and specialized services offered at our tertiary healthcare hospitals. The Ministry has implemented and is implementing various projects to expand and improve access to public health and social services. These include the construction of new health facilities, maintenance of existing ones, procurement of medical equipment, pharmaceuticals and clinical supplies, ambulances, and their accessories. I wish to front-load a number of priority programs and interventions being implemented by the Namibian government in the public health sector. 1, provision of pharmaceuticals and clinical supplies. For the past 3 years, Namibia has faced challenges regarding the supply of medicines and clinical supplies for public health facilities. The reasons for these challenges are varied and multifactorial. These include legal challenges to procurement process for medicines, lengthy procedures legislated under the Public Procurement Act of 2015, low procurement threshold as per Procurement Act, poor performance by suppliers, shortage of active pharmaceutical ingredients for some products, adverse markets of scale, and disruptions to international logistical channels. The Ministry has addressed and continues to address these challenges by introducing various measures, which include obtaining exemption from the Ministry of Finance and Public Enterprises, direct procurement through market scan for suppliers with stock on hand, utilization of pool procurement mechanism, putting in place multi-year frameworks agreements, bilateral cooperation with other countries for joint procurements, and utilization of the SADC pool procurement price database to inform benchmarking of prices in order to achieve value for money. These measures have started to bear fruit, and we will pursue them in a resolute manner. We are confident that in the next few months, the stockout of pharmaceuticals and clinical supplies will be resolved. Expansion of and introduction of new health services in the public health facilities. The government has approved the introduction of additional health care services in state-owned health facilities. This includes the establishment of intensive care units in all district hospitals around the country, the establishment of dialysis units in several hospitals across the country, the expansion of dental services, and the improvement of oncology services. Before COVID-19 pandemic, there were less than 25 intensive care unit beds in the public health sector. It is for this reason that the ministry has decided to establish intensive care units in all 34 district hospitals around the country. This capacity is important for service delivery and ensuring that services are brought closer to our communities. For a long time, Namibians had to travel long distances from different parts of the country to access dialysis services, mainly in Windhoek, or the government had to spend millions of dollars to refer state patients to private dialysis centers. The government was spending up to 100 million per year for these activities. It has therefore been decided that dialysis service will be established at Katotura Intermediate Hospital, Keetmanshoop, Rundu, Oshakati, Oshwarongo, and Walvis Bay hospitals. The facilities at Katotura and Oshakati Intermediate Hospital have been completed and will be commissioned for service in the coming weeks. Dental services are also being expanded. The ministry has procured medical equipment, including 20 dental chairs, 20 dental x-rays, 20 dental autoclaves, and related accessories. They have been installed at various health facilities in the country, especially in localities where these services were not available. We are talking about places such as Enhana, Kurenkuru, Rundu, Tsumeb, Ndangwa, Otapi, Ocho, Chivarango, Grootfontein, Rehoboth, Opuo, Onanjokwe, and Keetmanshoop. These services has been expanded also at Katotura Intermediate Hospital. High-end medical equipment has also been procured and installed at different health facilities. During the 2023-2024 financial year, 13 operating tables, 20 electrocardiographs, 97 infant incubators, 20 dental chairs, 20 dental x-rays, and 18 dental autoclaves were procured and installed at various public health facilities. We have also installed ceiling suspended x-ray unit and digital fluoroscopy unit at referral hospitals. In June last year, the ministry commissioned the picture archive and communication system and radiology information system at a cost of 19.3 million Namibia dollars at the 5 referral hospitals to digitalize the storage and transfer of patients' imaging records at these facilities. Awards have been made for the supply of several other equipment, including mobile examination light, theater light, laparoscopic units, cardiotocography machines, ICU monitors, patient monitors, and dental chairs for public hospitals. The ministry's quality surveillance laboratory, which tests and analyzes medicines to confirm conformance to set standards, received the International Organization for Standardization, that is ISO/IEC 172.5 of 2017, accredited by the SADC Accreditation Services. Upgrading and strengthening the provision of medical oxygen. With a difficult COVID-19 lesson in mind, the ministry has installed oxygen generating systems at different health facilities around the country. This includes Onanjokwe, Mariental, Swakopmund, Kakarara, and St. Mary hospitals, as well as Keetmanshoop, Okahao, and Nana, Okongo, and Andara hospitals, which were installed during February this year. Most district hospitals and health centers have installed oxygen generating capabilities. Now let me turn to capital project and maintenance of public health infrastructure. Several capital projects were completed during 2023-2024 financial year. This included the construction of Shamaturu, Karuhwa, Skrufito clinics, Keetmanshoop Hospital TB wards, Windhoek Central Hospital uninterrupted power supply system for theaters, Okakarara District Hospital laundry and kitchen, installation and commissioning of electricity backup generators at Andara, Okongo, and Okahao District Hospitals, and installation of additional groundwater tank reservoir for Umthia District Hospital. Construction is ongoing at Onamafila, Epupa, Linyati, Okonjatu, Malengalenga, Onankulo clinics, and Austen Care Health Center, which also include staff accommodation. There is progress with the upgrading of electricity supply at the Windhoek Central Hospital, construction of Onanjokwe Pediatric Ward Phase A, and installation of solar water heating system and water softening plant for kitchen and laundry at Okakarara District Hospital. Katutura Intermediate Hospital is undergoing major renovation, upgrading, and restructuring. On the 1st of November 2023, the late President, His Excellency Dr. Hage Geingob, may his soul rest in peace, inaugurated the newly renovated emergency center at Katutura Intermediate Hospital. Several wards at different floors in the hospital are undergoing renovations, which will improve the appearance, hygiene, and service delivery at the hospital. The renovation work has necessitated temporary relocation of some patients to other areas of the hospital, including the field hospital that was used during COVID-19 pandemic. This is a temporary arrangement. The ministry is undertaking the development and construction of the Windhoek District Hospital. The new facility will provide general outpatient and inpatient care in order to reduce the workload and referrals to Katutura Intermediate Hospital. The project is being implemented on a fast-track basis. Let me now turn to developmental social services. The last time we informed you that Namibia is taking significant steps to address substance abuse and mental health challenges. We referred to the Tagameno Rehabilitation and Resource Center that continue to provide essential treatment and psychosocial support for alcohol and drug dependency, with the expansion of outpatient services to more regions, reflecting a commitment to broader access to rehabilitation. On responding to outbreak, the ministry is working around the clock to address diseases such as HIV/AIDS, malaria, and TB. Our surveillance and response teams are primed to and have intensified efforts to overcome these diseases. I've said it before and will say it again, that prevention is always better than cure. Therefore, good health must start in our homes, in our community, and in our schools. It is for this reason that I call upon all Namibians to cooperate with the public health authorities as we combat diseases that may occur in our communities. As a ministry, as a government, we will spare no effort, we will not relent in our endeavors to serve our people and to provide them with the best health care achievable. That's my undertaking to the people of Namibia. Our efforts in the health sector have been recognized both in Namibia and in the global health fraternity. We have received international awards, especially in the field of HIV and hepatitis B prevention and control. The Namibian delegation to the negotiations for the international instrument to manage health emergencies has attracted admiration of other health professionals. We thank the government of Namibia for creating environment and providing a support system that make it possible for Namibia to shine. I thank you.
Thank you, Honourable Minister, for that comprehensive update on critical matters on health-related issues and development. Your dedication on keeping the Namibian nation informed is deeply appreciated. Now, the next segment is intentionally set aside for the media practitioners in the House this morning. If any of you have questions for the Honourable Minister, please step closer to the podium and briefly put your queries or questions to the Honourable Minister to respond to. And of course, introduce your media institution that you represent this morning. Thank you. We have, all right. Right.
Good morning. Good morning, Minister. My name is Salima Enoch from NBC. Yes. I just wanted to find out about Etegameno. Is that the only government rehabilitation center that we have? And perhaps maybe just, I don't know if you mentioned that there are renovations that are happening with the rehabilitation center, and maybe just the operation in itself, because I have been getting questions in terms of those that want to seek help. How can they apply, and also just in terms of the process of getting people, how does it work? Maybe you can just give us a brief on that. And also just I wanted to find out if we are allowed to go and see the progress with the renovations at Katutura Hospital, just to report on it. Thank you.
Okay.
All right. You've captured those, Honourable?
Yeah.
Okay.
Let me start with the last question, whether it's possible to go and visit the Katutura Hospital to see the progress with the construction and renovation. Yes, you are allowed. What you need to go, you can approach the office of the medical superintendent, and they can allow you to go and see the renovation. It will obviously be taken in such a way that since there is construction going on, there are also risks to individuals. So they will make sure that you are protected from the debris and from any other things which may harm you. But yes, it is allowed. The second question, or the first rather, was on the Etagameno rehabilitation. We have, unfortunately, many cases of drug dependency, alcohol-induced psychosomatic illnesses. And these people in an acute stage, they are being managed in the hospitals. And then after that, they can be referred to the Etagameno for rehabilitations. Yeah, I just wanted to say that there is a procedure to be followed. You may not just stand up from home and say, I'm going to Etagameno to be admitted. No. First of all, you have to undergo, analysis to ensure that, okay, you are out of the acute stage and that you have transitioned to the chronic stage, and then where you can be managed in the rehabilitation center.
Right. Okay. Salima, are you satisfied with the doctor's response to your question? Yes. Or do you have any more follow-up questions?
No, thank you.
All right. All right. We have no more questions from the House. I believe then, Honourable Minister, your comprehensive report was quite clear. However, I wanted to find out from you, Honourable, of recent there was an update in the media that there is an outbreak in Omaruru somewhere. How's the ministry bringing that under cause? How is it managing it?
Well, we experience outbreaks time and again, but we have a very robust surveillance system which picks up every outbreak in any part of the country. And the moment it has been detected, then our response teams are put in action, and they take the necessary precautions, engaging the community, how to contain, the outbreak, and then take the necessary measure to eradicate the outbreak. At the present moment, we don't have any concern about that anymore. It has been brought under control. But I just want to assure the public that our surveillance system is very much robust. I can also give example that some few years ago, we had an outbreak of Crimean Congo hemorrhagic fever, but it was picked up immediately, and that was the only case which were registered because of the response team and the activities which have been taken to contain that no secondary infection occurred. That is how our system is working.
Right. Okay. Now, thank you, Honourable Minister, for reassuring the Namibian nation that indeed our health is in good hands. And that is also all the time we had for today's discussion. Honourable Minister, I just want to pause here and thank you and your leadership for the efforts in keeping us informed on health-related measures and your commitment to transparency and public health is highly and very highly appreciated and commendable. We thank you so much for availing yourself a time this morning to come and update the Namibian nation on health-related matters.
It is always our pleasure, and we are ready anytime to share information with the public. And I can assure the public that we have your best interests at heart and never hesitate to approach us for anything.
Right. Thank you so much, Honourable Minister. Namibia, that is all the time we had for today's discussion. Please do join us again next time when we'll unpack another fruitful discussion here or update here at the Government Information Center. I am also just here to inform you that please go out in numbers and register to get your registration cards for the November elections this year. Until next time, from myself and the entire GIC production crew, take care.